Hi, I'm Heather Tyler. I'm Move Coordinator for the new hospital project for the Brunel building opening in 2014 next year in North Bristol. I'm here to explain to you about a patient journey through the theatres and the Medi Room complex. This is one of 72 Medi Rooms split across 2 floors. They run in a long bank all the way down. They're all identical. You'll see the first thing we have are very wide doors to allow for beds and trolleys to pass through very easily. We have integrated blinds within the doors, operated from inside to encourage privacy and dignity, which is incredibly important for all our patients. As we come into one of the Medi Rooms, this is the first point that the patient will come to in part of their journey. They will arrive here on the day of their operation. They'll be admitted to a Medi Room. It's a light and airy room, and they'll be able to meet with the consultant here and their anaesthetist. They'll be consented, they'll have the operation explained to them, and they'll be looked after here by a team of clinical and medical staff ready to then go to theatre for their operation. We have a bed head here, and it contains all their integrated clinical gases, oxygen, air, suction, lots and lots of medical plugs for all the equipment that's used. The Medi Room is then also used following surgery, where the patient is brought back into effectively what is now their recovery area. If they're then staying in hospital with us, we would then take them through onto one of the clinical wards on the other side of the Brunel building. This is one of the many staff bases within the Medi Room complex. There's plenty of room for the clinical and medical staff to work, lots of data and power sockets on both sides. We've got the 2 medical gas alarm panels as well as a nurse call panel, and it also allows clear visibility to the adjacent Medi Rooms. This is one of 2 seated assessment recovery areas. There are 6 areas for patients to sit, split between male and female, and it's for those patients coming for whom they're having very, very minor procedures or very light anaesthetic or sedation. This is one of the 24 theatres in the Brunel building, split over 2 floors. They're all identical in size, and they are larger than the largest theatre that we have now in the existing Southmead and French Hospital. Within theatre itself then, we have in the corner the sterile trough sink for the surgeons to scrub up with. We also have pendants that are flexible and movable throughout theatre from the ceiling, and they contain integrated medical gases, medical data points, power, and we can attach syringe drivers and pumps and things to those. We also have the lighting system, and what we have in the ceiling in some of the theatres is a canopy which provides laminar flow ultra clean air for those procedures that are high infection risks. This is the anaesthetic corner. The difference that we have now in theatres here at the new Brunel building is that there are no anaesthetic rooms in this hospital. So this is the first place that the patient will come into theatre, and they'll be admitted into the anaesthetic corner where the anaesthetist will be ready for the patient. Each of the theatres has a surgeon's panel. This contains main and generator power, but it's also the timer for the procedure. It also tells us what the humidity is and the temperature in theatre constantly. It also provides an alarm system should anything go wrong, and it's an intercom system. We're now in the sterile surgical prep area. It's an area that connects 2 theatres, and you can see here that we've got a panel where we can see straight through into theatre, and equally from the other side in theatre, so the anaesthetists and the clinical team can signal out to the teams working here. This is the main clinical corridor that runs from one length of the hospital right up to the other. The purpose of the clinical corridor is to divide all the core clinical acute work that's going on one side of the building from the clinical wards on that side of the building. Along the clinical corridor there would be no members of the public, literally only beds and trolleys being pushed from those clinical areas. Here we have bed lifts coming up from areas such as intensive care, theatres on the floor below, ED down on level 0. And these beds would come up in the bed lifts, and the only way to get across onto the clinical areas is across these glass bridges here, which takes you directly straight into the ward areas, again, where there are no members of the public access from this point. And this is one of the single inpatient rooms that a patient will be brought back to following their journey through theatre and into the Medi Room's recovery back onto a clinical ward here.